Limitations of HbA1c. How does HbA1c vary by race and ethnicity? The A1c test is a commonly used tool for diagnosing and managing diabetes by measuring the average blood sugar levels over the past 2 to 3 months. While it is a valuable tool, it has certain limitations and variations, including differences in results based on race and ethnicity. Limitations of A1c. Hemoglobin variants. A1c may be affected by hemoglobin variants, which are more common in certain populations. These variants can affect the accuracy of the test. Anemia. People with certain types of anemia may have inaccurate A1c results. Shortened red blood cell lifespan. Conditions that shorten the lifespan of red blood cells, such as hemolytic anemia, can lead to lower A1c levels. Elevated red blood cell turnover. Conditions that increase the turnover of red blood cells, such as pregnancy, can affect A1c levels. Race and ethnicity. There are variations in the average A1c levels among different racial and ethnic groups. Research has shown that there are differences in A1c levels among various racial and ethnic groups. According to the National Institutes of Health, some studies suggest that certain racial and ethnic groups tend to have higher or lower A1c levels even when their average blood sugar levels are similar. For example, studies have indicated that African Americans tend to have higher A1c levels compared to non-Hispanic whites, even after controlling for factors like age, duration of diabetes, and average blood glucose levels. Other studies have shown that Hispanics may have slightly higher A1c levels compared to non-Hispanic whites. These differences may be due to genetic factors, as well as differences in lifestyle, diet, access to healthcare, and socioeconomic factors among different racial and ethnic groups. What are normal A1c levels, and how does this depend on racial and ethnic groups? A person without diabetes mellitus has an average A1c below 5.7%. People with prediabetes, who are at risk for developing type 2 diabetes, normally have an A1c between 5.7% and 6.4%. Though A1c is proven to be very helpful in diagnosing diabetes, this measure alone is not appropriate to help guide therapy decisions. According to the American Diabetes Association, studies show that all non-white racial and ethnic groups have slightly higher normal A1c levels than white people. Compared to white individuals with prediabetes, who have an average A1c of 5.78%, the results will show there is little difference. Let's look over those results. First, would you help us by hitting the like and subscribe buttons? We appreciate your support. Now look at these different groups. Black individuals with prediabetes have an average A1c of 6.18%. Indigenous individuals with prediabetes have an average A1c of 6.12%. Asian individuals with prediabetes have an average A1c of 6%. Hispanic individuals have an average A1c of 5.93%. Now, here is an important factor to look at. By studying this data, you will see these 4 variations are negligible. I suspect that if you line up these examples, it makes little or no difference in the big picture. Ask any endocrinologist, I'll bet they will confirm this. Hemoglobin variants can affect the results of some A1c tests. These variants are more common in some parts of the world, such as Africa, South and Southeast Asia, and the Mediterranean. If your ancestors came from these regions, you may have a form of hemoglobin in your blood that could affect your A1c test results. So the question remains, with all factors considered, does the HbA1c test matter, or is it just one tool for determining a patient's probability of becoming diabetic? What is the test for diabetes other than A1c? Fructosamine and glycated albumin. These are used less often than A1c and give a 2-week snapshot of your blood glucose levels. So here is the recap on this issue. HbA1c is the standard test for determining a 3-month average of your blood glucose. Individuals from different regions of the world may have slight variations in the average A1c than Western countries, but there are not great differences and there are still more tests to determine a person's propensity to developing diabetes. We hope you have found this video helpful. In a future video we will explore what some feel is an even more important measure than the HbA1c to measure long-term impact of diabetes in diabetic health. Thanks for watching and we look forward to talking again soon.